Before the games, there was fear. Before the masks, there was disease. 1549 China, the first record of violation, a dangerous attempt to survive smallpox. 1796 England, Edward Jenner creates the first true vaccine using cowpox to stop smallpox. 1805 Philippines, the Bombers Expedition brings vaccines to Manila. The first global immunization campaign begins. 1885 France, rabies vaccine developed. 1845 USA, first influenza vaccine. 1960 oral polio vaccine saves millions. 97-1 MMR vaccine combines protection into one shot. 1976 Philippines, mass immunization program launched, protecting children nationwide. 2017 Philippines, vaccine controversy spreads fear and trust begins to fall. 2019 Philippines, measles returns, thousands infected, a consequence of doubt. 2020 global, COVID-19 vaccines developed in record time, a scientific breakthrough against a global threat, yet people still question. So the frontmen created a game to test beliefs, because history already proved the real danger was never the vaccine. Welcome, players. You are here to test your knowledge of vaccines, what protects you, and what puts you at risk. In these games, every choice has consequences. Survive and prove you understand. Players, you may proceed to your first game.
Scientists have engineered 6 primary vaccine technologies to protect populations from preventable diseases. You are now playing Bingo. Pick the type of vaccine according to the question provided. Run to the door labeled with the type of vaccine before the time ends. Round 1. Types of vaccine. Good luck!
Go with the door with a type of vaccine.
Live attenuated vaccines. These vaccines use a weakened form of the live germ that causes a disease. They create a strong and long-lasting immune response. 1 or 2 doses often provide lifetime protection. Examples are measles, mumps, rubella, and smallpox. For limitations, people with weakened immune systems or organ transplants must consult a doctor before use. They require constant cold storage. This makes distribution difficult in areas with limited refrigeration.
The second type of vaccine is inactivated vaccines. Scientists kill the pathogen to make these vaccines. The dead germ cannot cause disease but is still strong enough to trigger an immune response. Examples are hepatitis A, flu shots, polio shots, and rabies. Limitations are that they produce a weaker immune response than live vaccines. patients require multiple doses or booster shots over time to maintain immunity.
Polysaccharide vaccines. These vaccines target bacteria encased in a sugar layer. They train the immune system to recognize and attack this outer surface. Examples include pneumococcal disease and meningococcal disease. Limitations are they fail to generate an effective immune response in children under 2 years old. They also provide short-term immunity and do not create strong immune memory.
In conjugate vaccines, scientists attach the bacterial sugar layer to a carrier protein. This combination helps the immune system respond more strongly to the sugar casing and improves long-term immune memory. For example, the Haemophilus influenzae type B or HIB and pneumococcal disease. The limitations for this are they require highly complex and expensive manufacturing processes. Patients often need multiple primary doses to build complete immunity.
Protein-based vaccines. These vaccines use isolated proteins from the surface of a virus or bacteria. The immune system targets these specific proteins rather than the whole germ or its sugar coat. Examples are hepatitis B, human papillovirus, whooping cough, and shingles. Limitations: the isolated proteins alone often produce a weak immune response. Manufacturers must include adjuvants in the formula, and patients require multiple doses to maintain protection.
The toxoid vaccines. Some bacteria release toxins that cause disease. Toxoid vaccines use weakened versions of these toxins to create immunity against the harmful products rather than the bacteria itself. Examples include the diphtheria and the tetanus. For limitations, the protection fades over time. Patients need regular booster shots to stay protected.
Viral vector vaccines. These vaccines use a modified virus to deliver genetic material into our cells, helping the immune system recognize and fight the disease. Examples include COVID-19 vaccines like Johnson & Johnson and the Ebola vaccine. The limitation is that previous immunity to the carrier virus can reduce its effectiveness.
Messenger RNA or mRNA vaccines. These vaccines deliver genetic instructions to the cells. The cells read the mRNA and build a protein unique to the virus. The immune system recognizes the foreign protein and builds antibodies to destroy it. Examples are COVID-19 and respiratory syncytial virus. Limitations include requiring extreme cold storage conditions and that they degrade rapidly upon mishandling.
Did you know that many countries around the world reached around 60 to 80% full vaccination of COVID-19 vaccine? These are designed to help the body recognize and fight the virus effectively without causing the disease itself. Welcome to round 2, types of COVID vaccine. Good luck!
둥글게 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 빙글빙글 돌아가며 춤을 춥시다. 손뼉을 치면서 노래를 부르며
Go to the door with the correct match of example and vaccine type. Welcome to Dalgona. Measles is a highly contagious viral disease spread through the respiratory route. Did you know that in the Philippines and the world, reported measles cases are very high around 2019 and had a significant drop during 2020 to 2021 and then had a gradual increase afterward? For it to be consistently dropping, the best prevention is the MMR or MMRV vaccines, or the measles, mumps, rubella, or with varicella vaccines. Carve either MMR or MMRV to win the game. Player 236 eliminated.
The MMR contains a combination of measles, mumps, and rubella vaccines. So this can prevent, of course, measles, mumps, and rubella. Most of the people who are vaccinated with MMR will be protected for life. But take note that the MMR vaccine may be given at the same time as other vaccines. So children with 12 months to 12 years of age might receive the MMR vaccine together with the varicella vaccine in a single shot known as the MMRV.
MMRV vaccine. The MMRV vaccine combines protection against measles, mumps, rubella, and varicella or chickenpox. It is given to children aged 12 months to 12 years and usually provides lifelong protection. It can be administered with other vaccines or given separately as MMR and varicella shots.
How is MMR and MMRV given? For MMR, first dose is for 12 to 15 months old, and for second dose, it is 4 to 6 years old. For MMRV, first dose is for 12 to 15 months old, and for second dose, it is 4 to 6 years old, but it can also be given 3 months after first dose. Also, take note, if you're not immune and get exposed, ask your doctor about the MMR vaccine. It's safe to get even after exposure and may help prevent the disease. For measles vaccine recommendations, refer to this summary table to find the MMR recommendations based on age and status by the Centers for Disease Control and Prevention or CDC. Some recommendations include for older children, adolescents, and adults. They also need 1 or 2 doses of MMR vaccine if they don't have evidence of immunity. Doses should be separated at least 28 days apart, and for anyone traveling internationally, they should be fully vaccinated before traveling. Infants 6 to 11 months old should get 1 dose of the MMR vaccine before travel. Then they should get 2 more doses after their first birthday.
Who and who shouldn't get vaccinated? Those who should get MMR are students or post-high school, healthcare workers, international travelers, women before pregnancy, and people at risk during mumps outbreaks. While those who shouldn't get MMR or should ask doctors first are those with severe allergy to MMR or MMRV or its components, pregnant women, those with weak immune system or family history of it, and those with easy bruising or bleeding conditions. We should note that we should delay the vaccination if we had recent blood transfusion, which we should wait for 3 months. People with tuberculosis or had another vaccine in the last 4 weeks, and those who are currently sick or unwell. People who should have extra caution for MMRV are those with history of seizures or family history, and those who are taking aspirin or salicylates.
How safe and effective is the MMR or MMRV vaccine? It is safe and effective against measles, mumps, and rubella. Side effects are usually mild and go away on their own, and is also safe for breastfeeding women. Notes: protection against mumps may decrease over time. Second, vaccinated people can still get sick, but symptoms are milder and less likely to spread the disease. And lastly, there is no link between the MMR vaccine and autism. Scientists in the US and other countries have carefully studied the MMR vaccine. None has found a link between autism and the MMR vaccine. For the first disease is the measles. 1 dose effectiveness is 93%, and second doses effectiveness is 97%. Mumps, 72% for the first dose effectiveness, and 86% for second doses effectiveness. And lastly is rubella. For first dose effectiveness is 97%.
Wait, before we play the next game, What is the correct administration of vaccines? What are the rights of vaccine administration? And why is it important to ensure safety, avoid errors, and provide effective protection against diseases? And what healthcare providers must follow proper guidelines and techniques throughout the vaccination process?
There are 7 rights of vaccine administration. First is right patient. Before administering any vaccine, the healthcare provider must verify the patient's identity and assess for any contraindications or precautions. Second, right time. Follow the recommended immunization schedule and ensure the vaccine has not expired. Third, right vaccine. Ensure that the correct vaccine is selected and properly prepared. Fourth, right dose. Administer the exact recommended amount of vaccine. Fifth, right route. Use the correct route of administration such as intramuscular, subcutaneous, oral, or intranasal. Sixth, right site. Select the appropriate anatomical site based on the patient's age. And lastly, right documentation. All details of the vaccination must be accurately recorded. Before administration, proper vaccine preparation must be observed, starting with proper hand hygiene. Vaccines should be checked for expiration date, appearance, and possible contamination before use. They must be stored at the recommended temperature and prepared in a clean, designated area away from distractions. Healthcare providers should follow the manufacturer's instructions. Use a new sterile needle and syringe for each dose and prepare vaccines only when ready to administer.
The correct needle size and gauge should be selected based on the patient's age, weight, and route of administration. Needles and syringes must never be reused. All used materials should be disposed of immediately in puncture-proof sharps containers. These practices help prevent needle stick injuries and reduce the risk of infection and disease transmission.
For routes, vaccines can be administered through different routes, including intramuscular, subcutaneous, intradermal, oral, and intranasal. For intramuscular, we inject at a 90-degree angle into the muscle. For subcutaneous, we inject at a 45-degree angle into the fatty tissues. For intradermal, it is given superficially. For oral, it is administered as drops by mouth. And for intranasal, it is sprayed into the nostrils. The recommended injection sites vary depending on age, with the anterolateral thigh, commonly used for infants, and the deltoid muscle for older children and adults. Proper positioning of the patient is also important to prevent injury or complications.
Welcome, players, to your next game. Today's game will test precision. Before you begin, you must understand the risk. A rare condition called SIRVA, shoulder injury related to vaccine administration. It happens when a vaccine is given incorrectly. Instead of the deltoid muscle, the needle reaches deeper structures, the bursa, tendons, joint, and sometimes nerves. This may cause pain, stiffness, and limited movement within 24 to 48 hours. But remember, this injury is preventable. All it takes is correct technique. Now, all you have to do is answer my questions about it. Move when it's correct, and stop when it's wrong. Good luck! Does SIRVA occur when a vaccine is injected too high or too deep into the shoulder instead of the deltoid muscle?
Green light.
Primary cause of SIRVA. SIRVA commonly occurs due to improper injection technique. First, when injection is placed too high on the upper arm. When injection is placed too deep, reaching the bursa or joint capsule. Incorrect needle length selection. And last, improper angle of insertion. These errors can cause tissue injury or inflammation in the shoulder.
Does Servo cause persistent shoulder pain and limited range of motion shortly after vaccination?
Green light.
Symptoms are: first, severe shoulder pain beyond normal post-vaccination soreness. Second, pain starting within 24 to 48 hours. Third, limited range of motion. Fourth, shoulder stiffness. Fifth, weakness. Sixth, swelling or tenderness. And lastly, symptoms lasting weeks to months.
Does Servo cause permanent structural damage exclusively to the humeral bone due to vaccine toxicity?
Red light.
Player 1 eliminated.
Injuries associated with improper vaccine administration. So, errors in incorrect injection technique or placement can lead to various shoulder injuries collectively associated with SIRVA. These conditions typically involve inflammation or damage to the structures within the shoulder, resulting in pain and limited function. So, common injuries include number 1, brachial neuritis, which are the inflammation of the brachial plexus and causes severe shoulder pain along with weakness and numbness that may extend to the arm and hand. Number 2 is deltoid bursitis, which is the inflammation of the bursa within the deltoid muscle, leading to pain, swelling, and reduced shoulder mobility. The third one is adhesive capsulitis or frozen shoulder. It is characterized by stiffness and persistent pain that results from inflammation and thickening of the joint capsule, restricting movement. The fourth one is the impingement syndrome. It occurs when rotator cuff tendons are compressed within the shoulder joint, which causes pain, inflammation, and decreased range of motion. Rotator cuff injuries. So this includes tears or strains of the shoulder muscles and tendons, leading to pain, weakness, and difficulty with lifting or rotating the arm. The sixth is shoulder bursitis, which is the inflammation of the bursa within the shoulder joint. It results to pain, swelling, and limited movement. Number 7 and the last is tendinitis, which is the inflammation of shoulder tendons, causing pain and difficulty in movement. So these injuries can significantly interfere with daily activities and overall quality of life. Individuals who experience persistent shoulder pain or restricted movement following vaccination are advised to seek medical evaluation for proper diagnosis and management.
Is SIRVA diagnosis likely when symptoms appear weeks to months after vaccination and affect both shoulders equally?
Red light.
Player 271 eliminated.
SIRVA can be diagnosed by a healthcare professional such as a general practitioner, specialist, or allied health provider such as a physiotherapist through evaluation of the patient's symptoms and medical history, particularly in relation to a recent vaccination. The clinician typically conducts a physical examination and reviews the onset and pattern of symptoms. Patients are asked about pain, limited shoulder movement, and when these symptoms began after receiving the injection. A diagnosis is more likely if the following criteria are present. First, the shoulder was asymptomatic prior to vaccination. Second, symptoms developed within hours to days after the injection. And lastly, pain and limited movement are localized to the vaccinated arm. Healthcare providers may also perform diagnostic tests to rule out other possible conditions, such as infections or rheumatic diseases like arthritis. Imaging studies may be recommended to support the diagnosis, including ultrasound, which uses sound waves to visualize internal shoulder structures, and magnetic resonance imaging or MRI, which uses magnetic fields and radio waves to produce detailed images. These imaging tests may reveal abnormalities such as bursitis, synovitis, adhesive capsulitis, impingement syndrome, and tendon tears. Early recognition of SIRVA is important, as prompt diagnosis allows for timely management, which may help reduce the severity and duration of symptoms.
Is reducing inflammation and pain by medications the most common first-line treatment for SIRVA?
Green light.
Treatment. Management of SIRVA focuses on relieving pain, restoring shoulder function, and reducing inflammation. Patients are advised to consult a healthcare professional if they experience significant pain or difficulty moving the shoulder following vaccination. Treatment options may vary depending on the severity of the condition and can include the following. First is medication, like over-the-counter pain relievers and anti-inflammatory drugs, prescription pain medications or stronger anti-inflammatory agents, and oral corticosteroids to reduce inflammation. Second is injection, which is administered directly into the shoulder joint. Third is rehabilitation and supportive care, which includes physical therapy to improve mobility and strength, physiotherapy or other allied health interventions, and massage therapy to help relieve muscle tension. Lastly is surgical management. Surgery may be considered in severe cases, although this is rare. The choice of treatment depends on the patient's symptoms and response to initial management. Early intervention is important to improve recovery outcomes. However, current evidence suggests that further research is still needed to determine the most effective treatment approach for SIRVA.
Can SIRVA claims be filed within 3 years from the date of vaccination?
Green light.
SIRVA lawsuit or VICP. The National Vaccine Injury Compensation Program, also known as VICP, is a US-based program established in 1986 to provide financial assistance to individuals who experience vaccine-related injuries, including SIRVA. Its purpose is to help ensure a stable vaccine supply, reduce the need for lengthy legal cases, and provide an accessible way for individuals to receive compensation. The program is administered by the Health Resources and Services Administration, also known as HRSA, with involvement from other government agencies in processing and deciding claims. Cases are handled by the U.S. Court of Federal Claims, often referred to as the Vaccine Court, and do not involve a jury. Since its implementation in 1988, the program has provided compensation to individuals affected by covered vaccines, including cases of SIRVA. In some instances, compensations may also be granted through settlement without a formal decision. Individuals who qualify under VICP may receive compensation for the following: medical expenses, lost wages, and other related costs. Following this, several legal considerations are associated with SIRVA. Number 1 is legal liability. Healthcare providers are expected to administer vaccines properly. Errors in technique or negligence may result in liability and eligibility for compensation. Second, product liability. Vaccine manufacturers may face legal claims if their products are linked to injury. And last but not the least is the statute of limitations. Claims are generally required to be filed within 3 years from the date of vaccination. Certain exceptions may apply depending on the situation.
Welcome to your last game, players. Test your immunity, which is the body's ability to recognize, resist, and eliminate pathogens on the glass bridge. A question will be announced, and step into the glass with the correct answer. What type of immunity is produced when the body is exposed to weakened or inactivated pathogens through vaccination, leading to the formation of memory cells and long-term protection?
So, how do vaccines work? Vaccines contain weakened or attenuated pathogens, killed inactive pathogens, toxoid, inactivated toxin, mRNA, or subunit components. But these do not cause disease, but stimulate immune response. It results in antibody production or the formation of memory cells and long-term protection. The characteristics of active immunity contains slow onset from days to weeks, long-lasting from months to lifelong, has memory cells, and stronger upon re-exposure.
What type of immunity provides immediate but short-term protection through the injection of antibodies, commonly used in emergency situations and post-exposure cases such as rabies or snake bites, but does not create memory cells?
Artificial passive immunity. This involves giving ready-made antibodies through immunoglobulin injections. It is used in emergencies or after exposure to a disease. Examples include rabies immunoglobulin, tetanus antitoxin, hepatitis B immunoglobulin, and antivenom. It provides immediate but short-term protection and does not create memory cells.
What term refers to the unintended physiological response that occur after vaccination, caused by the body's immune reaction, which are usually mild, temporary, and self-limiting?
Side effects of vaccines. Vaccine side effects are unintended physiological responses that occur after vaccination as a result of the body's immune system reacting to the vaccine antigen or its components. So these reactions may be expected or unexpected. The expected are the normal immune response, while the unexpected are rare adverse reactions. Most are mild, self-limiting, and temporary, resolving without treatment.
What type of vaccine reaction is limited to the injection site, caused by local inflammation, presenting as pain, redness, swelling, and warmth, and usually resolves within 1 to 3 days?
Local reactions. Local reactions are inflammatory responses confined to the site of injection, occurring due to tissue irritation and activation of the immune system at the injection area. Examples are: first, pain due to nerve stimulation; second, redness or erythema; third, swelling or edema; and lastly is warmth at the injection site. Onset and duration. First, it begins within hours and resolves in 1 to 3 days.
What type of vaccine reaction affects the entire body, caused by immune mediators circulating in the bloodstream, and presents with symptoms like fever, fatigue, headache, and muscle pain within 6 to 24 hours?
Systemic reactions are generalized responses affecting the whole body, caused by the circulation of immune mediators after vaccination. Its pathophysiology include: first, immune activation releases cytokines into the bloodstream. Second, it affects hypothalamus, which results to fever. Third, it affects the muscles, which results in aches. And fourth, it affects the brain, which causes fatigue and headache. Examples include fever or pyrexia, malaise or general discomfort, fatigue, headache, and myalgia or muscle pain. Its onset and duration, it usually occurs within 6 to 24 hours and lasts 1 to 3 days.
What type of vaccine reaction is caused by hypersensitivity to a vaccine component, ranging from mild symptoms like rash and itching to a severe life-threatening condition with difficulty breathing, low blood pressure, and possible loss of consciousness.
Allergic reactions or hypersensitivity reactions. Allergic reactions are immune responses triggered by hypersensitivity to a vaccine component such as egg protein, gelatin, or preservatives. A mild allergic reaction is a non-life-threatening hypersensitivity reaction involving superficial tissues. Its mechanism involves an IgE-mediated immune response with histamine release leading to skin symptoms. Examples include rash, hives, and itching. A severe allergic reaction or anaphylaxis is a rapid, life-threatening systemic hypersensitivity reaction that affects multiple organ systems. Its pathophysiology involves a massive release of histamine and other mediators, causing vasodilation leading to a drop in blood pressure, bronchoconstriction leading to difficulty in breathing, and airway swelling leading to obstruction. Signs and symptoms include difficulty of breathing, swelling of the face, lips, and throat, hypotension, rapid pulse, and loss of consciousness in severe cases. The onset is usually within minutes after vaccination, and it requires immediate emergency treatment such as epinephrine.
Mukhang tayo na lang natitira. Sino sa tingin mo mananalo sa atin?
Di ko alam pero alam ko pareho tayo nandito para malaman natin kung ba't ba talaga mahalaga yung bakuna.
Uy, ba't yan? Do you think I'll spare your life? Spare your life? Isa ka rin sa kanila eh. Hindi totoo yung mga bakuna na yan. Kaya ako ginawa tong game na to para iparealize sa inyo na dapat hindi kayo maniwala sa bakuna. Pwede ka kaya magkaroon ng allergic reaction. Madami rin tong side effects. Pwede ka pa mamatay. O kaya maging sintu-sintu ka.
Lasha, ikaw talaga yung may sayad. Vaccines can prevent diseases kaya less chances of spreading din to sa iba. Tsaka pwede pa tayo magkaroon ng herd immunity. Tsaka may chance din na mas ma-eradicate yung isang disease. Tsaka, syempre, pinaka-importante sa lahat, yung tinatrain natin yung ng vaccines yung katawan natin para ma-recognize and, syempre, fight pathogens without actually catching the disease.
Hindi ako naniniwala. Kaya dapat kayo rin.
I believe, naniniwala ako, na dapat lahat tayo ay magpabakuna. Siyempre, dapat kayo din. Lalo na if ang isang community ay may alam at kamalayan sa kahalagahan nito. Dahil maiwasan natin dito yung mga misinformation, myths, at syempre yung vaccine hesitancy. Hesitancy? Joke. If the community is aware at involved sa pagpapabakuna, bukod din sa pagkakaroon ng herd immunity kung saan mas protektado ang isang komunidad mula sa isang outbreak, ang pagpapabakuna will lead to higher immunization coverage at better control of vaccine-preventable diseases. Wow, English! Kaya, wag matakot sa bakuna. Matakot kayo sa sakit. And dahil dyan, I wanna tell the world, the universe rather, that I am fully vaccinated with a heart and I thank you.